Hi, my topic today is about lower limb amputation, specifically for individuals who get a prosthesis. We're going to look at some adaptive exercise programming techniques. So, a few introductory points. There are two main causes of getting an amputation. The first one is going to be trauma, of course, such as a car accident. And the second one is going to be illnesses, such as diabetes. And interestingly, 60% of all lower limb amputations are from diabetes. And there also are some congenital illnesses which might cause a limb deformity, which might bring on a need for a prosthesis. So that, of course, is something else to consider. And more than 50% of amputees do participate in sports and physical activity after their amputation. So it's definitely not an end of all physical activity when someone has an amputation. And there are many different prosthetics out there. An example of this is going to be, an individual with a lower limb amputation might have a walking leg prosthesis, and they may also have a running blade prosthesis specifically for when they're running. So what are some challenges facing amputees? Well, first of all, there's phantom limb pain, and this is the sensation as if they still have that portion of the limb and as if it's in pain. It can be very excruciating, even though it's not a physiological pain or injury. It still is very much real, and it happens in a majority of individuals with amputations. They also will often experience residual limb pain, so excruciating pain within the stump or the remaining portion of that limb. They'll also often have balance issues, and this is because the center of mass is changed when a lower limb is amputated. Then they're also going to have proprioceptive challenges or changes, because if you're wearing a prosthesis, you're not going to be having that full sensation in the lower part of that limb. You're not going to be able to feel the exact terrain under your feet, for example. There often will also be postural issues, such as having an anterior tilt to the body, an excessive lumbar lordosis, an inability to balance correctly on the prosthesis. And there's also a greater metabolic requirement when you use a prosthesis. It actually burns more energy to walk with a prosthesis than with a natural limb. There may also be other compounding illnesses. Like I mentioned before, many individuals with amputations have diabetes or another infection or illness, and those must be taken into consideration. And then also, when you're learning to walk with a prosthesis, you have to learn new movement patterns, which may cause muscle imbalances, especially at the beginning while people are figuring out those new movements. And this is an example of that relearning of movement patterns. You can see here on the left-hand side, this is a 20-year-old track and field athlete, and she had just received her prosthesis here in this picture. And you can see how it's kind of kicked out to the side, and she's compensating a lot. And then over the course of a few months, she was able to work up to where she can be more straight in her gait pattern in the right-hand side. So a study or research article by Demir in 2020 detailed some important phases of the amputation process, some of which have some specific exercises associated with them, which might be very beneficial. This article by Demir goes into a lot more depth, so it's definitely worth reading. They have some excellent charts and tables as far as, what exercises are good at what stage. So in the preoperative stage, there's going to be like an assessment of range of motion, of strength, and of potential functional status in the future. There's also going to be physical therapy focusing on range of motion, stretching, strengthening, gait, posture, and respiratory exercises. And then in the postoperative and pre-prosthetic phases, so this is before the individual gets their prosthesis, there's going to be a management of the wound, of any pain, any edema that might happen. There's going to be functional activities of, just day-to-day activities that they might encounter. There's going to be also a lot of work to prevent muscle contractures For example, when you're getting your lower limb amputated, your hamstring is going to be shortened, which might cause the hip flexors to tighten up, and you'd have some contractures there. So some exercises that might help right at the beginning are going to be like joint range of motion and isometric exercises. Then you're going to move into strengthening the intact limb and the core. Then you're going to work on gait training, first with crutches. And you're going to work on respiratory and breathing techniques as well as balance. So some helpful exercises for an individual with an amputation and prosthesis. It's going to be balance training and specifically balance confidence. So a lot of times when an individual gets a prosthesis, they're a little bit nervous to put that full weight onto that leg, so they're compensating, and this can affect their balance. So doing exercises such as bilateral exercises can help them gain that confidence back to put that weight on the prosthesis. And one of those bilateral exercises is in that third point here. It's called fast feet, which is basically where they're quickly going from side to side, from one foot to another, shifting their weight, and this is building that confidence. Core and hip exercises are also very important, and dynamic exercises. So the dynamic exercises that I listed here come from limb power, which I'll talk about more in a little bit, but they're exercises such as monster steps, side steps, backwards walking, push-ups, squats, weaving a ball or weight through the legs, things like that. Things that really shift the weight forward and back, side to side. And here's another chart. This one comes from the Santer article. These are exercises and progressions in a variety of categories. You can read them here. For example, core activation, weight acceptance, strength, and speed, and then a list of the different exercises that could be helpful. And these, of course, could be integrated into a sports program or a PE session, even with groups. So, like I mentioned, those exercises could be included in group participatory activities. And what I noticed from my reading and research is that individuals with prosthetics can generally take part in almost any activity. They may need some accommodation, and they may need some extra help with balance and strength and any injury concerns, but generally they can really take part in anything. And so the most difficult aspect is going to be working on their own confidence and on any stigmas from the people around them. So Miller et al. Conducted a meta-analysis in 2019, and they showed that participation was hindered most of the time because of a lack of motivation or educational experiences, as well as a lack of support and self-efficacy. So again, that confidence. And then special concerns about the amputation, such as a lack of equipment or difficulties in the environment. But again, a big one was just having that support around them and also having that confidence to take part in the activities that they may have thought that they would never be able to do again. And here are some additional resources. Like I mentioned, Limb Power has some great videos. They have actually dozens of videos showing the exercises in detail, as well as some info sheets and just some great information there. The Amputee Coalition also had some great information and a list of exercises to do with an individual with an amputation or with a prosthetic. And here are my references. Thank you very much.